We're here with Peter Piot to discuss global health. At the European Universities Institute's State of the Union conference, there was a panel about global health. After the panic, can we avoid the neglect? Peter, welcome. Thanks for being with us today.
Good to see you again.
Yeah, exactly. It's really great to connect again after a while to discuss global health issues. And in fact, we're in a world at the moment where there are multiple crises. And many fear that we are facing a lost decade for sustainable development, in particular for the most vulnerable people around the world. So my first question to you is, what is the main challenge you see to make sure that we improve health equitably worldwide?
First of all, it's certainly true that we're facing multiple crises, but the good news is that in the last 10 and 20 years, we've made enormous progress in terms of health worldwide, except for those countries where there's conflict. That is a different story. But people live longer, mortality for, let's say, under 5 years old, maternal mortality, all that has improved tremendously. However, there are always those who are left behind. And that's we saw that also with the COVID pandemic, that it's the most vulnerable. In the case of COVID, can be old age or people with other conditions, but also the poorest, the ones who are marginalized in society, have been hit the most. And so for us, the challenge is that now to make sure that we concentrate our efforts much more on those who are left behind and reach them with vaccination programs. That's not only a matter of let's say the services, but also trust in vaccines and knowing about it. We see a huge wave of what we could call non-communicable diseases. They're the big killers of the future, and already now, from diabetes to cardiovascular disease, mental health, all that. So we need to also shift that. But again, the good news is that in entire parts of the globe, particularly in Asia, that we see enormous progress in terms of health. But we need to work together much better, and we need to pay more attention to these inequalities. And we've seen that with the vaccines against COVID, because there was shortage. And scarcity is one of the biggest enemies of equity.
Yeah. You kind of paint a picture of where there are multiple challenges also in terms of health. And some of them are also concerning neglected diseases, neglected populations. But what does it mean if we are, in a situation where there's a war in Ukraine, there's a full attention on what is happening over there? Does that also put maybe funding mechanisms or opportunities to actually do something about all those other things that need to be looked at? Are those at risk, or how do you look at that?
On the one hand, this COVID pandemic has really put health, global health, epidemic preparedness on the top agenda, also of politicians. And it's still there when you go to, the European Union has really taken things in hand in an unprecedented way when it comes to health, because health has traditionally not been a legal competency of the EU. But now there's the Health Union, we have the creation of the HERA, the Health Emergency Response and Preparedness Authority. We have expanded mandate for the European Medicines Agency, etc. So there are things that are being built. And I think it's important in these times when shortage is the shortage of memory, we tend to forget, and that's not necessarily bad, that we have the war in Ukraine and so on, that we build now the institutions that will be kind of our insurance against future pandemics. And I think Europe and many of the member states of the EU are doing that. However, it will be a challenge in terms of keeping the money there. But I always say, look, we have fire brigades, and everybody agrees that, we need fire brigades also when there's no fire, and that we're not going to disband the fire brigade when the last house has burned down and then set it up again when there's a new fire. We need that all the time. And that's a very important message. And that doesn't have to cost a lot, but we need to invest there. And we need also to invest in trust, that people trust the science, that trust that we have to do something collectively and work together also internationally.
Yeah, those are important messages, Peter. What are the opportunities, are there specific opportunities in the governance sphere where we can actually do something very concrete to build health resilience?
At the panel here, the State of the Union event, we talked a lot about that. And I think there's good work in progress at the global level. And why is that important is that, you know, no country can deal with a pandemic on its own, even if you're an island, you know, because this is very rapidly a global problem. Viruses don't know borders, don't need a passport and so on. And so strengthening that system around the World Health Organization, but not only. We have a pandemic preparedness fund that is managed by the World Bank, that we have a commitment to exchange information, because what's key is that we know as soon as possible when a new virus emerges. And that means that countries have to share that information. But also it means that a country should not be punished when it shares that information. As we saw, for example, when Omicron, this variant of this coronavirus, was discovered in South Africa, many countries issued a ban on travel from South Africa. So that's, and there is no good scientific reason for that. So at the global level, but at the regional level also. And I think the regions have emerged as a very important entity and cluster for managing pandemics. The Africa region, and that's a silver lining of this epidemic, for the first time really through the African Union and the Africa Centers for Disease Control, have really taken on their destiny in their own hands, negotiated directly with companies for vaccines, issued policies and so on. And that's where we have to go. I'm a strong believer. We saw that in Europe, in Africa, in Southeast Asia. We'll go for that. And these are governance and policy opportunities, but they need political leadership. Yeah. You know, and that's what we need. We were lucky in Europe to have Ursula von der Leyen, who took that leadership, who at a time when it was not a legal competency for of the EU.
Yeah.
So,
and you know, this governance sphere is of course crucially important for health, and in fact. You mentioned the COVID-19 pandemic, of course, which has been like a major topic for citizens around the world for a few years now. But of course, maybe also a topic that leads to some misconceptions about, you know, has this pandemic been handled right or not, and by whom? And could we have prevented it? What should have been done differently? Could you tell us about some of the most important misconceptions that you come across in your work on this topic?
Well, first of all, a general one, and that is that epidemics have always been part of the human condition, and we will get more. It's not that there's some conspiracy that someone invented them or created them. No, they will happen over and over again, and we need to be prepared. That's the first, I would say, sometimes misconception. Secondly, of course, today we have the benefit of hindsight. But when this epidemic hit well over 3 years ago now, all we knew, it is a virus, and it's a virus that is respiratory transmitted, but how effectively, efficiently, that was not all that clear. So we had to take a lot of decisions in the absence of hard data. But what we've seen is, retrospectively, the countries that have done best are the ones in East and Southeast Asia. And, you know, because they had experience with SARS epidemic in 2003, and they were very fast in complete lockdown in measures that in some countries, in Europe certainly, would not be acceptable by the population. But it was very effective. And we also had, you know, massive wearing of masks in these countries, like in Japan, in Singapore, where they continue to do that. It's social etiquette. If your nose is running, you're coughing, you wear a mask to protect others. That is, you know, and if you don't do that, that's as bad as, let's say, lighting a cigarette in the hall of a hospital here in Europe. So we should go to that social etiquette also. And when I go in the metro or in the bus or so, I wear a mask because I'm, you know, over 70 and I'm vulnerable, not only for COVID, but also for other viruses. And then a common misconception I've heard, and that's to do with trust in vaccines. And I understand that people have questions, but if we had a vaccines, we were very lucky. That vaccine has saved about 20 million people's lives. And the misconception is that in 10 months' time, you know, we fabricated that vaccine out of nothing. That's not true. This is based on about 20 years of basic research on this mRNA vaccines. And so we were lucky for two reasons. One, that research had been done, that we knew how to do the technology and so on. And two, that we had a virus against which we could make a vaccine. Let's not forget, against HIV, 40 years later, we still don't have a vaccine. Yeah. So it's a combination of, let's say, beliefs and trust, and that what we knew and didn't know, but also new technology that have given opportunities. Just as imagine that we would not have had the digital technology for communication. Where video conferencing, what we can use, that has enabled many millions of people to work remotely and safely. 20 years ago, it would not have been possible. Yeah. So it's a combination of technology, but also how we engage with it as a society, as individuals, and trust is fundamental for that.
Great. Peter, you have really kind of given us a snapshot of a lot of important things happening in global health, and in the process also maybe help to understand some of the things that are difficult to understand about pandemics, about viruses, how they, and what you actually can do about them in the policy sphere. So thank you so much for coming here.
Pleasure. Thank you.